period irregularities, and then we talked about weight gain, but weight gain and hair loss, and then some health screenings that people would want to do during this time would be to get the mammograms, and that starts at age 21. And then some common health risks for people in their 40s. We're starting to worry about bone health. Our bones grow till we're 30, and then they just from there kind of maintain. So we want to grow our bones, do weight-bearing exercises, things like that, and then we want to continue those things after our 40s to maintain that bone density that we've gained. And then in our 40s, which can be younger, but it's where you start to see a lot of autoimmune pop up. Hashimoto's, which is thyroid, rheumatoid arthritis, a lot of the chronic health conditions that we have, and I know Dr. Peterson is talking about that, but that has to do with our immune health and foundations, again, of our gut health that causes those autoimmune. And then heart disease and stroke is thrown in with that, and type 2 diabetes. And then vulval vaginitis. That's just infections of the vaginal vulval area, the area around the vaginal opening. And that's one of the most common gynecological problems in women around this age. And then, of course, we start to worry about breast, ovarian, and endometrial cancer. And there's not any screens for the ovarian and the endometrial. Family history is probably the best indicator that might be a problem that you'll be at risk at, but screenings for breast cancer is your mammograms. So the average age is 40 to 45, depending on which society that you talk to. The Gynecological Society is 40, Cancer Society is 45, but somewhere in that range you should be getting a baseline mammogram so that we can see baseline where that breast tissue is and what it looks like. Of course, if you have family history of people that have had breast cancer before this, you need to start your screenings before that. Okay, and then in 50s, that's when we start menopause. So average age of menopause is about 52. That brings on lovely things, hot flashes, nice sweats, irregular periods as we're building up to that, bleeding, that's crazy, and vaginal dryness, depression, and anxiety also come with that. So that's not just menopause, that's leading up to that. More and more, I am seeing women that are in perimenopause in their 30s. And women that are on birth control, birth control stops our body's production of its own hormones. And so I'll have girls that will come in that are 25, have all the symptoms of menopause. Vaginal dryness, they're moody, they're anxious, they can't sleep, painful intercourse, and I run their hormone levels, and of course, yes, there's menopause levels. So birth control is not our own estradiol, it's not our own progesterone. They're different molecules, they do different things. So they do give feedback to our brain that we have enough, which shuts down our body's production of them. So menopausal symptoms can be seen across the range. We don't have to wait till we're 52. So in menopause, our ovaries produce less estrogen, and then less estrogen can cause our body mass or our bone mass to start going away. Estrogen is a signal for our bones to keep building, and we've always got signals for our bones to break down, build up, and estrogen is a strong message to our bones to keep building, keep building. And then this can lead to other problems too, because as our bones start breaking down at a more rapid rate, all the lead that we've been exposed to throughout our lifetime, it kind of gets stored in our bones, and so that starts kind of getting dumped out, and that can be hard for our kidneys, it can be hard on our liver that has to try to process those things. It can lead to the hardening of the arteries, which is the atherosclerosis, high blood pressure, things like that are adversely will affect our health. So 1 in 3 women that are in menopause will also have, or in their 50s, will also have stress incontinence. So that's leakage of urine when you cough, you sneeze, you bear down kind of hard, you jump, things like that. So they also might have dry eyes and start to need reading glasses, which usually happens about 40. So, but by the time you're 50, most people are going to need some reading glasses. And then 91% of the colorectal cancers happen in people that are this age, and we're going to talk about ways to avoid that. But the screenings you'd want to get at this age was colonoscopy, and then also, I think, because that's what I do as hormones, is that I think you should check your hormones. Okay, and peasing, obviously it's a verb. It's a funny word, but not a funny problem. So we don't want to be peasing. Okay, so common risk factors for women that are in their 60s. Heart disease significantly increases for both men and women, and it accounts for more than about 20% of deaths among men and women in the ages of 65 to 74. So it is the most common cause of death. And the paper that I handed out talked about the warning signs for a heart attack in women, because like I said, they are different than men. And then the risk of stroke doubles with every decade after age 55. So, and skin becomes fragile, has less collagen, less elastin, less fibrinogen, less young looking. And as you'll see, all of these things, hormones helps. So hormones are very important for all of these problems, and we'll go over that. So in their 70s, osteoporosis is a concern for women. That's when our bones become less and less dense, more and more porous, and then, of course, heart disease. So right after menopause, women so before menopause, women have less of a risk of heart disease than men. After menopause, their risk for heart disease is the same as men. And that, again, is due to estrogen, and estrogen's an impact on our heart and our vessels, and we'll go through that. So in the 80s, women are at risk more at risk for falls. Cardiovascular problems still continue to be concerns: high blood pressure, diabetes, hearing and vision loss, dizziness, muscle weakness, bladder problems, of course, always after. And it depends. So I see bladder problems because that's something that I work with quite a bit in women that are 25, have had one baby, can't run anymore because they leak urine. So there are ways that we can fix that, and I'll talk to you about that as well. And then 73% of Americans over 85 do experience some mobility problems that can increase their chance for falls. All that being said, people are the happiest. People report when they do surveys that after about 40, they're the happiest. And quality of life doesn't necessarily decrease as we age. In fact, people that are older report oftentimes that they are much happier than people that are younger. So aging can be a very good thing. Okay, so this one I'm going to go over just briefly. It's the top 5 causes of death in women. So there's your heart disease, and then we've got cancer, chronic lower respiratory disease. So this is a topic that really I don't need to talk as much about, you guys, because most people that get lung disease have been former or current smokers. So maybe some of you, maybe that was a former thing, but smoking is the single worst thing that somebody can do for their body. So anybody that you know that smokes, and anybody that I see that smokes, I always give them an invitation to help them to stop. Stopping smoking is very hard, very hard. It takes anywhere from 7 to 10 tries to quit smoking. It's very, very hard, but it is the single worst thing that somebody can do for their body because it affects every single organ and cell in the body. So heart disease, cancer, the lower respiratory disease, stroke, all of those are increased by smoking. Okay, and then type 2 diabetes and Alzheimer's, that's a lot about our diet. That is very, very controllable. Nobody needs to have type 2 diabetes be an issue for them. Either we can control it through diet, or we can give people insulin that will help to lower the effects that high blood sugar would have on their body. So those are risks that are all modifiable. Now, we always have genetic roles that come into play. Genetics and epigenetics, which is what our environment does to our genetics, can turn genes on, turn genes off, make us more susceptible. So I tell people, those people that have those genetic risks, they have to work harder at keeping themselves healthy. And some things, I had a presenter one time say that if you had complete faith that you could be healed. And I believe that that is true, but I believe that that's only true if that's in God's plan for you. So there are lots of people that get sicknesses, they get illnesses, and go through them just fine, and other people, we do all the right things, and they still pass away. And this was brought home to me a couple days ago. Anyway, I was out of town, but that day we had all the snow Thursday morning. My daughter was driving her little Hyundai, and she was coming down the point of the mountain, and it was all slushy. She was going about 40 because her little car, lots of slush, and her car just started spinning, and it spun out face going the other way right in front of a semi, who just smashed her. That car is completely smashed, and she has a big gash on her head, and that's about it. That's about it. And so God is in control. Don't ever forget that. So there are certain health issues that teach us things that we need to go through. So faith is not in whether or not that I will be healed. Faith is in God's plan for me and what He has for me to learn and where I need to do my work at, whether it's here or on the other side. Okay, so it's interesting though that these are the statistics for health issues, but when we survey women, women's highest concerns for health issues is mental health issues. And I really feel like mental health issues affect all of those other issues that you see there. And so we don't say somebody died from anxiety and depression. Well, I guess if they committed suicide, that would be. But if, we don't say that they died from that, but all of those things contribute to how their health is that would make them have problems with the other things. So, and then, of course, cancer. And I think women rank that. It is second, so they did a good job on that. But that is something that we fear because a lot of that we feel is out of our control, and some of it definitely is. So, and then heart disease, including stroke, and then obesity, which there again, obesity ties into all of those diagnoses above of what caused death in women. And then their other concerns was reproductive and sexual health. So we are. And God created us to be sexual beings. I mean, that is part of His plan. That is part of making a marriage one and whole. It's very, very important, and oftentimes it gets neglected. It doesn't get talked about, but it's a very, very vital part of our health, and God created us that way. Okay, so the top concern, heart disease. There I've got the modifiable risk, things that you can do to change that, and we talked a lot about those. Prevention is controlling your blood sugars, your cholesterol, your weight, and your blood pressure. Exercising daily, eating foods that are not inflammatory, and that would look like whole foods. So whole grains, fruits and vegetables, lots of good proteins, lots of good fats. We have this myth in our society that was stemmed from research that was paid off by sugar companies that fat is bad for us. And fat is not bad for us. Refined and processed things are bad for us. Fat that's been changed is bad for us. Chemically, when we have fatty acids and we change them to trans fatty acid, we change those bonds. And it makes a molecule that our body's not very good at taking care of. Similar to when we process, corn syrup and we make it high fructose corn syrup. It changes the chemical structure of that. Not very good for our body. So we want to limit sugars. Sugars are inflammatory for everybody. Everybody. So we want to limit our sugars and the refined and processed foods. And then, obviously, no smoking or stop smoking. And then I've added in, and I'm going to go through vitamins in depth more, but I wanted you to kind of see them in relationship to the problems that we were talking about. So vitamins that will help with that, vitamin D, specifically D3, your B vitamins, your magnesium, your coenzyme Q10, the alpha lipoic acid, your alpha lipoic acid, your fish oils, and probiotics. And then screening, your annual blood work that you get with your cholesterol, your triglycerides, your kidney and liver, all those are screenings that we can look at, and then your blood sugars, and then monitoring your blood pressure. So a lot of the damage, cholesterol's had a bad rap, I'm just going to tell you. Cholesterol's job is to repair. It goes out and repairs. Cholesterol's job is also to make hormones. If we don't have enough cholesterol, we're not really making our hormones very well. But when we have high blood pressure, we have all these arteries, and they do, think of a little snake. And every angle that we've got to go at, we've got pressure. And it's hitting, it's hitting, it's hitting. It causes damage to those artery walls. Cholesterol runs out there and repairs it. It does it by putting a little Band-Aid, if you will, on it. It kind of blocks it off. That becomes what we call a fatty streak. And then more pressure breaks that off. And we've got things that travel through our body and cause embolisms or clotting of arteries. We can get strokes, we can get heart attacks, our arteries get clogged. And if we don't have sufficient vitamins, and estrogen also helps with this as well, then our arteries become stiff. So arteries should open up nicely when blood needs to have less pressure. So say we drink a whole bunch of water, we got lots of volume, our arteries should open up, keep that blood pressure controlled. They should tighten back down. We get dehydrated in the morning, we want to stand up quickly, we need blood to go from here to our brain fast. It should accommodate all that. When it starts to get sclerotic, it doesn't have that elasticity like it should. So our blood pressure increases. Breast cancer. So the most common, it's the most common cancer in women, but it's second to lung cancer for deaths. So risk factors is age, genetics, 5 to 10%. Sorry, your genetics make it rough for you. But family and personal history, which there's your genetics. If you have an abnormal breast biopsy that happens early on, if you've got chest radiation that happens early on, early onset of menstruation, so how early you started your periods puts you at a little bit more risk of having breast cancer. And then not having children, that also does. And then prevention is we can control weight. I was just going to say we could have more children. I'm just kidding. And breastfeed them. I should be protected for a while. We can exercise, eat plenty of whole foods, and obviously the smoking piece again. And then things that will help, vitamin D, and I'll talk to you about why that is. Probiotics, I'll talk to you about why that is. And then get your mammogram screenings every year. We talked about the age 40 to 45 is 40 to 45 is when we start those. Okay, I'm going to just flip through this one, but this is just the common diagnoses of cancer and then the most common cause of cancer deaths. So I do want to point out before I flip through there how high that colorectal cancer is. And in your sheet that I handed around, I talked about fiber, how we can increase our fiber. So we want our colon nice and happy. We don't want it inflamed. Fiber helps to scrub it. Fiber helps to pull out junk. Fiber helps it to keep moving. All those things are important, and we'll talk about that a little bit too. Osteoporosis. So risk factors: small, thin-boned, infrequent menstrual cycles, and then estrogen loss due to menopause. One of the conferences that I went to on women's health, so not as much here in the United States, we're kind of just starting to catch on to this, but Australia, New Zealand, Europe, they're starting to understand the danger of the birth control and the danger of suppressing our own body's hormones. Our body needs about 35 years of estrogen. If we don't have that, we're at increased risk for all those things, the heart disease, the bone, all of that. So we need we need the estrogen in our body. It plays a very important role. Okay, and then diets low in calcium and vitamin D. For a long time, we hit calcium super hard. Now we're realizing that if we don't have enough vitamin D, we don't absorb our calcium. So we got to have that vitamin D to be able to absorb the calcium adequately. And then again, prevention, talk about supplementing that calcium. Lack of exercise, I don't want to pass that one over. So that is just weight-bearing exercise. Just walking is a weight-bearing exercise. We got weight on us, we're walking. That's going to help our bones to build. The more that we have on them, especially 0 to 30, that tells our body we gotta be dense. We gotta fortify. That's why thin women are at risk, and so they can modify that risk by doing a lot of weight-bearing exercise. Okay, so adequate calcium, your weight-bearing exercises, eat a balanced diet, fruits, vegetables, calcium, vitamins, and then magnesium. Magnesium is kind of a twin to vitamin D. We'll talk about that a little bit when we get to the vitamins. And also calcium. They all need to be in balance. And then screenings, get your DEXA scan starting at age 65, sooner if there's certain risk factors, and have your vitamin D levels checked. Okay, here's the fiber, here's the colorectal cancer problems, constipation. This is also one of the first things when I start working on people's gut health and getting them feel better that I work on. Let's get you pooping every day. You have to. This is where you eliminate all your toxins. We want to get rid of those bad things. We don't want to keep it around. Okay. We also don't want you having such bad diarrhea that you eat and blowing out all your nutrients before you even get a chance to absorb them. So, but constipation is more of a problem than diarrhea, although diarrhea is a problem. So, ways that we can prevent that is to strengthen our pelvic floor when our vaginal wall is weak. Right where our colon exit, it kind of gets a little bit bulgy, and it just stuff stays there for a long time before it hits our little sphincter and says, we gotta void. Staying well hydrated is very important, and then maintaining a healthy gut flora, and that's the probiotics. It's eating the prebiotics, which is all of your fruits and your vegetables, and we'll go over that in a few minutes. And then limiting your sugars, your refined and processed foods. Those are very inflammatory to the gut lining, and really that inflammation in the gut lining is the beginnings of all those autoimmune diseases that we don't want to have. And then maintain a healthy weight, exercise regularly, and then some of the vitamins that we'll talk about in relationship to that would be the magnesium and your probiotics. Okay, here's the importance of fiber. Fiber cuts down your risk, obviously, of constipation, but it also reduces your risk of colon cancer, breast cancer, heart disease. So look at those percentages, all due to your being able to void, getting rid of those toxins, helping your body to detox. When young women, anybody comes into me and they have headaches, they have muscle aches, they have brain fatigue, they don't feel well, I ask them first thing, how often you're pooping? Not very often. When you poop, once, twice a week, it's not enough. Not enough. So I just get them pooping and wow, they feel better. They don't have these headaches. They don't have the stomach that hurts all the time. They're just rubbing and friction. That's going to increase infection. We're worried about smell, embarrassment. We can't travel very far, unable to do our desired activities, really hard to exercise. Yoga becomes a super popular exercise for women that can't bounce around because it works the core, it works everything, but we don't have to worry about urinary problems. And then we have recurring urinary infections as well. So incontinence happens because of the vaginal aging and the loss of the pelvic floor function. So estrogen is very important for that. But another thing is childbirth. So childbirth is a traumatic event, and we give Motrin, we give ibuprofen after delivery because we want to reduce that pain. However, that stops inflammation. Inflammation is a good thing, not to a large extent, which is what we try to control by giving the Motrin And I'm not saying don't take your pain medications after you have a baby, but it slows down that healing and the body regenerating that tissue in the vaginal wall. So here in the United States, we're a little bit behind on how to help those issues for women. Over in Europe, I had a sister-in-law that delivered over there, and she said it's not a matter of should we help our pelvic floor, it's part of the program. It's part of the maternal care that you get, that we're going to help restore the pelvic floor functioning and the vaginal wall strength. So the vaginal wall, I should have put a picture in here, but the vaginal wall is the core of the bladder wall and the rectum. So they all are side to side. You got the vaginal wall, on the bottom you've got the rectum, on the top you've got the bladder. So any problems that happen voiding or that vaginal wall, that pelvic floor, and research shows that like 98% of the voiding problems, and this is research done in Europe, comes from that pelvic floor vaginal wall problems. When you have a cystocele or a rectocele, which is when your bladder falls in or your rectum falls in, that, when they call that an AMP repair, it's anterior, posterior, top, bottom, that's the vaginal wall they're repairing. To hold those things, it's a space maker. It should hold its space. It should be stretchable and flexible. Think like a rubber band. It should expand, have a baby, come down tight nicely, hold a penis. That's what it should do. So when it loses that elasticity, when it loses that ability to stretch, you can have pain with intercourse. You have problems urinating. You have problems voiding, problems pooping. The tissue doesn't lubricate like it's supposed to. It just really doesn't fulfill the roles that it should, that it was made to do. So there's all type of treatments. I look at root cause, and a year and a half ago I found a treatment that addresses the root cause of these problems, and I've been doing it for about a year and a half, and every single woman that I've done the treatment on has had success. It's been very powerful, and I feel like it's very exciting for women. So intercourse problems, urinary problems, pooping problems, even women that will have traumatic births and have scarring. That scar tissue doesn't flex, it doesn't stretch, it doesn't lubricate, it doesn't fulfill the roles. It's not designed, scar tissue is not designed to do that, and you can regenerate scar tissue. Our body turns itself over all the time. Our largest bone in our body rebuilds itself about every 3 to 6 months. So the scars that we have, they have been programmed to be cells that are scars, and they just replenish themselves. So we need to get in there, interrupt that cell cycle, and tell it to program itself like it's supposed to be normal tissue. And then that tissue will perform the functions that it should. So the bipolar radio frequency, it stimulates the vaginal wall, the skin. We use it for acne scarring. We use it for stretch marks, to tighten skin, but it's an inflammatory response that is at a certain therapeutic temperature, certain energy, that doesn't cause damage, but causes our body to then make new collagen, new elastin, and new fibrinogen. And then this is just a quick questionnaire. Would it be for you? Do you leak urine? Do you have a hard time stopping your flow of urine? Do you wake up at night several times to pee? Do you have recurring UTIs? Have you had multiple births? Are you low in estrogen? Are you experience menopause or perimenopausal symptoms? Do you need lubrication to avoid dryness or pain with intercourse? Have you had cancer treatments? And that's a big one, because with cancer treatments, women for a period of time absolutely cannot have any hormones at all. And so vaginal dryness, vaginal tearing, the tissue becomes really thin. That's a big concern for them. And then vaginal itching, discharge, odor, irritation, or tenderness. There again, when our vaginal wall is working like it's supposed to, it should be a barrier for things that shouldn't come in. But when it's a little, we call it friable, but when it's easily irritated and kind of opened up, you think your skin, if it's really dry, things can get into it, and so you get more vaginal infections. And then just kind of how do these affect you? So that is the treatment that I do. There again, nighttime bathroom trips, vaginal looseness, recurring infections, urine leakage. I do have the only machine in Utah County. It's a painless treatment, quick results, takes less than 30 minutes. We do recommend that you get 3 treatments for it to be long-lasting, but women get results with the very first treatment. It is the only treatment that's FDA approved for sexual dysfunction and stress incontinence, and then strengthening that pelvic floor. Okay, so depression. Depression is the last top concern that I'm going to talk about for women. There's risk factors to that. Previous episodes, if you've had depressive episodes in the past, your risk of reoccurring are higher. Family history plays a role in that. If you've had heart problems. One thing that I've seen that I like to point out to people that we don't really think about it, if you know anybody that's had a heart attack, it's most likely that they're going to have depression afterwards. And so be vigilant of that. Watch for that, because we think maybe it's just because they were sick. We think maybe it was this. We think maybe it was that. But it's a very real thing. It's a very real thing, and it's usually in that first year after they've had significant heart problems. So we can be, vigilant. We can help people and help them to get help and realize that's not something that they have to just deal with. Also chronic illness, because it's hard to be sick all the time. And that can be very depressing. Even life-changing things, marital problems, substance abuse, certain medications can cause depression, vitamin deficiency. Anybody that comes into my office and tells me that they have depression, one of the first things that I check is their vitamin D. Here in Utah, people are always going to be low on vitamin D come January and February. And I'll get into that in just a few minutes, but that's a huge contributor. Thyroid disease, history of physical or sexual abuse. Those are things that need to be worked through. I did foster care about 17 children, so I've had a lot of foster care kids that have come through. And physical and sexual abuse has to be dealt with on every level of learning. So in other words, something that happens to us when we're age 8, we can interpret that with all the stuff that we know as age 8. When we get to be age 30, we now have a different conception of what that role should have been, who those people should have done, who we should have trusted, who we shouldn't have, how that should have went, and we have to work through that again, because now we've learned new things, and it's not to say that those things have to plague us our whole life, and I'm going to talk about that too, because all true healing happens through the Savior and His atonement. Everything can be healed. Everything. So it doesn't have to plague us, but we do have to work through it. And so that can cause depression. And then obviously being a worrier or over-anxious. If you're always worried about things and how they turn out, that's going to cause depression. And then having an eating disorder, that is sometimes the mental things that go into having an eating disorder, but it also can be from the vitamins and the nutrients that we're deficient in. So some prevention, find a reason to get up in the morning, set some goals, serve some people. I see a lot of young mothers that I feel work through their depression quite well because they have to get out of bed in the morning. They have to go, they have to take care of their kids, and so it does help them through it. I think sometimes it makes it harder, but it does help them through it because they just have to keep going. And then cultivate nurturing relationships, have people that we can talk to. These things are real, and sometimes just talking to them can really help. I went to, when I was in my undergrad at BYU, I went to the counselor. They have free counseling there. They have excellent counselors. And I went and talked to a counselor, and I realized that a lot of the benefit in talking to a counselor is that you have to articulate all the things that you're feeling. You have to process them. You have to put them in words. You have to talk about them. And so at a very young age, when I realized that, I'm like, well, I can talk to my Heavenly Father just like that. And so prayers are the best therapeutic session that you can ever have. Our Heavenly Father is the best counselor that you can ever go to. And it's free of charge. So when you say your prayers, or even if it's not prayer time and you need a therapy session, get on your knees and start articulating. Start going through what are concerns to you, how you think you should solve them, what things you think are not fair in life. Just go through all those things, and it will become clear to you the direction that you should be going. And if it doesn't, at least you will feel peace. And I can promise you that, because Heavenly Father cares. So our problems won't necessarily be fixed, and going to a counselor doesn't fix your problems either. It just helps you to understand them. It helps you to work through them. and it helps to get a different perspective. And Heavenly Father can do all that. He can do all that for you. Okay, so, and then of course, talk to your medical provider about concerns. Suicide is a big issue, especially here in Utah. I think we are very close to the top. I can't remember how close we are, but a lot of that goes on here. And so people just need to talk. People need to let things out. We need to not judge each other. We need to not think that we don't have problems, because you know what? Every single one of us in here has a problem. And I won't just say a problem. Every single one of us in here has problems. Okay? There's none of us that doesn't have a problem that we have to work through. And so reach out, let people help, and go to Heavenly Father in prayer, and ask Him to send people to reach out to, because we do need people here. I mean, there's been times even in my own life where I'm like, okay, it's great that I can talk to you, but I need somebody I can touch and feel and that's here. And that was a conversation I had with Heavenly Father when I was 16, and you know what? I felt a very real feel that somebody was there. But we can be that for each other. So reach out to people. Okay. So vitamin D, the B complexes, magnesium, omega-3, and probiotics. And I'm going to go through vitamins. I want to make sure I don't leave out. Yep, I got it. Good. Okay, vitamins. The power of what we eat. So in the Book of Mormon, and I was gonna look this up last night and I actually forgot and realized this morning, but in the Book of Mormon, I think it's in Nephi, he's talking about how there was sickness in the land, but not so much sickness as there could have been because of the plentiful herbs and plants that were around at that time and in that season. And I do believe, and I know that Heavenly Father has put the things that we need for us here on the earth to help us, to heal us, to help us to not be as sick. Hippocrates said that let thy food be thy medicine and thy medicine be thy food. So what we eat is powerful. Just like we wouldn't put pornography into our spirits and expect them to be healthy, we can't put garbage into our physical bodies and expect them to be healthy. Okay, so I'm going to go through kind of what I feel like are the most important vitamins and supplements that anybody of any age could have. Now, that doesn't mean that there aren't others that are great and there aren't others that are specific things. This is just a very generalization, because I know nothing about all of you, of what I think would be good and why. So a good multivitamin. Good multivitamin is going to just cover all of the basics so that you're getting the things that you need. The other one is B vitamins. B vitamins should come, most of the B vitamins help our skin, help our hair, help our energy. They're cofactors in many enzymatic processes that happen in our body. So a lot of the things that happen in our body, we need B vitamins to make them happen. They're also important for our moods and our energy. The powerhouse of our cell, the mitochondria, where all energy is produced, that's where they're cofactors, some of the vitamin Bs. And then they're important for neurotransmitter production and protection of nerves. Neuropathy, people that have neuropathy, they need to focus on B vitamins. Depression, we can treat treatment-resistant depression with L-methylfolate, which is the active form of B9. It's very important because it's the raw building materials that we need for the neurotransmitters in our brain that help us be happy. So when we don't have them, that's a problem. We talked about family history being a reason that we have depression. There's a genetic mutation that we're starting to understand a lot more about called the MTHFR gene mutation. It's a mutation that compromises our ability to methylate. And methylation is how we make our B12 and our folate active. If we have that genetic polymorphism where we don't do that as well, we're not going to activate our B vitamins very well. And so as there's other insults that happen to our body can't keep up with that methylation process, because methylation is how our body clears toxins. It's how our liver works. Everything that comes in order for our body to use it, it has to become lipid soluble, because all of our membranes are fat membranes, lipid membranes. In order for our body to excrete it, that happens through our kidneys, has to become water soluble. So our liver is involved in that whole process, and it gets bogged down when it can't methylate, when it can't make things active, when it can't make them water soluble to get rid of them. B vitamins, very important. Vascular health, I talked about the arteries being able to be elastic. The B vitamins are important for that artery health. Okay, and then magnesium. Magnesium, the best absorbable ones are bisglycinate or glycinate. Citrate we use to actually help as a diuretic, but your body's not going to absorb that super well. It's going to push it out before it absorbs it, but that's what we use it for. Citrate pulls water into the intestines, helps us to be able to be regular. But magnesium glycinate, it's the fourth most abundant mineral in our body. It has over 300 functions that it does. Magnesium is my most important vitamin that I tell people to take. So 70% of women are deficient in magnesium. It's just, they are. So headaches, muscle aches, constipation, anxiety, depression, irregular heartbeats, those are all magnesium. Those are all magnesium. So people just need to replenish their magnesium. So eating whole foods have magnesium in them, but a lot of our soils are getting depleted, and so we're doing less plants, a little bit less magnesium that's in them, and so we just need to be replenishing with magnesium. Yeah?
So how much would you recommend?
450 for women and 500 for men. And most people I start higher than that. I start about 800. And then as our body, our intestines are pretty good. As we have enough magnesium, our body our intestines stop absorbing it as much. And so it's left there in the intestines, in the colon, the small intestine. And magnesium causes a little bit of relaxation. So we start to have looser stools when we're having too much. Now, magnesium itself, being at the level that it should be, helps our stools be regular. But when we start being a little bit more than regular, then we've gotten too much magnesium. So part of that is the magnesium citrate. All magnesium is the same. It's how it's bound. And glycinate and bisglycinate just means one or two glycine molecules. Glycine molecules are amino acids. Amino acids transport things from our intestines out into our body. So from our mouth to our anus is actually a closed system. Things should not get out other than things that are transported or through osmosis or through channels that actually open up to allow them to come. And that's a lot of the foundation for, like I said, for autoimmune. And I know somebody else talk about that. So all right. So that was magnesium today. Okay, so fish oils, specifically omega-3s. So when you buy fish oils, that's all the fish oil. But the beneficial ones are the DHEA and the EPA. Those are the most beneficial. They reduce inflammation. They help our cholesterol and our triglycerides. They help our blood. They're very important for our brain. Like I said, all the cells in our body are phospholipid cells, which means they have fat, phosphorus. Yeah.
What do you do when you're burping at that all the time?
So we work on digestion.
Okay.
We give you more stomach acid. So we give you more stomach acid. There are better ones that you can buy that kind of eliminate that, but really if you're doing a lot of that burping back up, it's sitting in your stomach way too long, and we need to get it broken down into your intestines. So that's what I would do, is work on digestion. I mean, I had a lady that came to me just yesterday. I didn't pull any of her labs, but she has a primary care provider. She has all that, but I'm almost guaranteed that she is nutrient deficient on several things, even though she's taken vitamins, because she eats and she poops like literally that fast. Salad comes out, food comes out, everything comes out, and she can be taking those vitamins. I bet you if she's looking through her poop, they're in there too. So when your system is flushing things out that quickly, or even retaining it in. So if it's retaining it in, it doesn't necessarily mean it's digested. It means now the body's just soaking all those toxins out, all the water out. The longer it sits in there, the more compacted it gets. And that's why we have hard stools. But yeah, so I would work on digestion. There are ones, like I said, that have more lemon, lime type things. There's ones that are enteric coated that go through better, and it's very possible. So a lot of supplements, there's a varying degree of good and bad And some supplements, I mean, they might have been rancid before you even got them. They might not have been good. So anyway, so try to buy good quality things. When you buy fish oils, make sure that the omega-3s are outlined in the back. Yeah.
Do you have a brand of vitamins
That I like. There are lots of brands, so I hate to just say brands. In my office, I do ones that only providers can sell. So that wouldn't be fair for all of you. But if you look, things need to be good manufacturing practices, which even then is sometimes hard because there was just a reputable company that just had, well, fairly reputable, that just had the FDA come down on them because their good manufacturing practices were not good manufacturing practices. You want it third-party tested and verified, and you want that quality control all the time. With Amazon, which I buy lots of things on Amazon, but you have to know what you're looking for and stuff. But people literally, with as much stuff as put on there, could be out scraping up sand, putting it in your capsule, giving it to you, and telling you it's whatever that it is. So.
I've heard that with fish oil, if it does a certain thing in the freezer, if it's cloudy or not, then that's better quality. Have you heard about that?
I don't know. Yeah, I haven't heard about that enough to know. And I was just, as you're trying to tell me, thinking how that would matter. So if it was, so it should be liquid at room temperature. If it's freezing, but I think anything, if you put it in the freezer, is going to freeze. I don't know about being cloudy, so I actually haven't heard that, so I'm sorry. Can't speak to that.
So how can we tell if they're good?
If they're good?
I mean,
so,
if they're third party, whatever.
Yeah, so third party tested, good manufacturing practices.
Is that listed on the back?
Yes, so those
Oh,
are,
it will
those
say.
are, yes, those are,
Oh,
yeah, those
okay.
are people that go to the, it's very expensive to have things, make sure that they're validated, third party tested. So yeah, those will be on there because that's expensive.
Okay.
It's an expensive process, which is part of the thing when you're buying things that are inexpensive. Some things are not super expensive to make, and so they can be inexpensive. But other things, when you've got these high quality ones and they're expensive, and you've got this low quality one that's not, you've got to wonder what happened here, because this is an expensive process to make this and to make it good. And it's expensive to get that third-party testing all the time. One of the companies that I recommend in my office, they actually, any shipment that they get in, because a lot of these things will say made in the USA, but they get all their products from somewhere else, where the quality of collecting, of processing is not good standards at all. So they get them from somewhere else where they're not regulated. They bring them in and then they make them. When they get the shipping label of all of the ingredients that they're going to put in to make their formula, it says on there, what quality it is, what strength it is, the purity, things like that. But most companies don't ever pay to have that verified. They just take the label they get from India, they take the label they get from the Philippines, from China, wherever they get it, they're like, oh yeah, this is what it is. Whereas the companies that actually stand behind their products, that do that, they don't even take things into their factory, into their warehouse, without sending them to a third party to actually verify the purities, that there's not, heavy metals that are in there, that there's not other things that would be harmful that are in there, cancer forming, things like that. They do that before they even bring it in. If it's not good, they don't even accept the shipment. So there is a lot of process that goes into making things and making them good. Okay. So CoQ10, anybody that's on a statin should take CoQ10, and they should take about 300 milligrams of it. It reduces the oxidative damage that leads to that muscle fatigue, skin damage, brain and lung diseases. So statins block the production of coenzyme Q10. Coenzyme Q10 is actually one of the processes, or it's a cofactor in energy production in the mitochondria of our cell.
How much did you say?
So 300 if you're on a statin, 100 to 200 if you're not.
Okay.
So in the mitochondria of our cells, which every cell has a mitochondria, it's a little powerhouse that creates energy for the cell. Coenzyme Q10 is a cofactor in making that ATP, or that the energy for the cell. So it improves heart health and blood sugar regulation. It's an antioxidant, and they use it for prevention and treatment of cancer, because it is an antioxidant. And it also reduces the frequency of headaches. Okay, alpha lipoic acid. It's it helps our body to make the biggest antioxidant that our body has, and that's glutathione. It's anything that's an antioxidant is going to reduce free radicals. It's going to reduce the toxic load that we have in our body. It recharges all of the other antioxidants, so your vitamin C, your vitamin A, the CoQ10 that we just talked about, and their ability to keep fighting those reactive oxygen species. It is a prescription in Europe. In Europe, they use it for treatment of diabetes-related complications. There is a product out now that's alpha-lipoic acid. It's controlled release. It releases a little bit all during the day. It's not a prescription here in the United States, and it is very, very beneficial at controlling blood sugar. So it treats a variety of liver conditions. It offers neuroprotection, all your nerves. It preserves bone density. It chelates minerals, so it's going to help pull them out of the body if we don't need them. Prevents migraines and contributes to healthy skin. Okay, vitamin D. It has a little small list, but that's because it's like magnesium, one of my favorite ones. So we have vitamin D receptors on every single cell in our body. If you want to learn a little bit about vitamin D, there's actually vitamindresearch.org, something like that, that has a plethora of research studies on vitamin D. Bone health, like if people come in, I had a young girl come in, she was Indian, from India, dark skin, here in Utah, and she said, I have been everywhere. I feel like my arms, like they hurt. Like I think maybe they're broken, but they've done x-rays, there's nothing. They just hurt. And she said, my legs are starting to hurt. And I said, man, you probably don't have enough vitamin D. So sure enough, the ranges of vitamin D are 32 to 100. I like people about 60 to 80, and hers was like 7. So we just started her on vitamin D, and all of a sudden that bone pain went away. But chronic low back pain, that can be from vitamin D. Anybody that comes into me and they tell me I'm not motivated, I can't lose weight, I feel depressed, I say to them, we need to check your vitamin D levels. And sure enough, we get those up, and wow, I see them a month later and they're like, gosh, I haven't even done anything, and I've lost like 7 pounds, and I started my gym membership last week because I feel like great. And when I treat vitamin D levels that are low, I'm very aggressive. I mean, it's a fat-soluble vitamin, your body will hang on to it. I like to get those levels up, functioning like you're supposed to.
How do you help with absorption if they have trouble absorbing vitamins?
I work on their gut again. Yeah. Anybody that I give things to and I measure their levels after we've done it for 2 or 3 months and they're not up where they should be, I work on their gut. But to be honest with you, pretty much everybody that comes in, I work on their gut. But when they come back and they haven't got those levels good, then I'm like, okay, we got to be more aggressive.
How much should a normal, like a 40-something-year-old
Have.
per
So
day?
5,000 international units here in Utah from September to March is what I have people take. So that is a high dose, and people will tell you that's a high dose, but I like levels 60 to 80. So there's a retired heart surgeon by the name of Dr. Gundry that lives in California. He's created lots of different things for heart surgery, but he doesn't do surgery anymore. He actually sees people, not hands-on, but teaches them how to protect their heart and be heart healthy, and he likes vitamin D levels at 120. Now, that's not standard of care, so I don't do that, but I do like them 60 to 80. And so you're going to go in and you're going to be told that your levels are normal. And you're going to be like, okay, that's great. What are my levels? That's what you can ask them. What are my levels? Because normal is a very broad range, and normal means you are not in a disease state. However, with vitamin D, every single cancer is linked with low vitamin D. So we can't say vitamin D causes cancer, but in every patient that has cancer, they have low vitamin D levels. And people that are chronically sick have a very hard time keeping up their vitamin D levels. You just have to pour it into them like crazy because they burn through it like crazy. Same with the magnesium. When our body is stressed, the cells dump out magnesium to try to protect our nerves. So who isn't under stress? Okay? B vitamins, the same thing. Our bodies just burn through those like crazy because of the environment that we live in, because of the world that we live in, because of the assaults that are always coming in on our body all of the time. So So yes, all of those are tested. In fact, you can even test your omega-3s, your alpha-lipoic acid. In traditional medicine, that's going to be kind of expensive because they don't test it very often, but you can test those.
So then how do you know what's normal and what's optimal
For
whatever?
So in functional medicine, the Institute of Functional Medicine, A4M, they have done studies. And even traditional medicine has done studies. So like when I talk about vitamin D and those links, it's been researched a lot, but any medical doctor, they have absolutely no nutritional training whatsoever, none. There is not any in any of their courses of study, which is one of the reasons that I chose to be a doctorate of nursing practice. So my background is the nursing model, which is a little bit different than the medical model, and even different than a DO model. But we look at the person as a whole. So what is the whole piece? Whereas the medical model, and not to shame any of the medical models, it's perfect for what it does. But it looks at symptoms and how do we treat those, and it's very effective at that. But I like to look at the whole, and I think that they're all important. I think that supplements are important, and I think that medicine is important. And I feel like these camps where people divide and they say, nope, only doing medicine, or nope, we're not doing any medicine, we're just doing herbs and supplements. Well, these are toolboxes that all knowledge comes from God. President Nelson said, we don't create new things, we don't create new knowledge, we don't create that, it's discovered. So all these things are things that are given to us by God. We just have to know when to use them and when to use them appropriately. For example, I had a gentleman that came into me because he heard that I'd done functional medicine. He just had a couple stents placed in his heart, he'd had bypass, and he's like, I don't want to take my medications. And I was like, well, sorry. If you would have came to me like 20 years ago, maybe I could have helped you not to take your medications, but that's what you have to take. I mean, antibiotics are not good for our gut health, but you know what? They are some of the most powerful things that we can take when we need them, and we have to take them. You just need to know how to restore your gut when you're done. I mean, we don't want to be naive and push, all these things out, because all of them have been given to us by God. Our responsibility as stewards is to learn how to use them appropriately. Okay.
Multivitamin, and then you listed all those others. Do you have to look at the multivitamins so you're not getting too many of because multivitamins have some of
All those in it.
like a D3 and all that. So are we supposed to
most of the vitamins, when you look at them, they give you, a multivitamin gives you like 25% of your daily value for most of the things. So it's kind of a catch-all. Okay. So it's saying, we're hoping that you're eating the other 75% and that you're getting it in your diet, because we're going to supplement you with just the 25%. So it's not, some of them will have higher doses on it. The B vitamins, if you get too much of them, you pee them out. So basically you're just wasting your money, but you're not harming your body at all. And B vitamins actually are one of the vitamins that I give people in fairly high doses because they make a big difference. Any weight loss, I was going to talk about that too. Any weight loss program that you get on, what's popular with it? B12 injections, right? Mm-hmm. Yeah, because it helps our energy levels so much, and it helps us to feel good, which is going to translate into more energy, doing more things, being happier, being able to lose weight. Vitamin D, they've done research on it. And so anybody from the 20 to 30 range, so 30 is optimal, or 30 is where we start at the beginning of the bottom range, 32. So in order to be normal, you need to be 32 to 100. So they've done studies, people 20 to 30, 30 to 40, I think I even did 10 to 20, and weight loss, and putting people, taking out all the other variables, putting people together when your vitamin D levels are higher in that 30 to 40, 40 to 50, you can lose weight easier. So it's just, and then I talked about cancers too. Yeah, every vitamin D, every cancer that there is low vitamin D. Vitamin D is huge for immune functioning.
So I feel like you're saying B complex is a good choice.
Yeah.
Is that right?
Yeah.
And then, so what would be the amount that you would recommend?
So a B complex has all the B vitamins in it. So it would be really hard for me to recommend. I can recommend B12. Anybody over 50 should supplement with B12 and vitamin D, always. B12 actually comes from our meats. So anybody that's vegan is not going to get their B12. They're going to have to supplement with it. So B12, about 2,500 micrograms daily. And then the 5,000 international units of the vitamin D during those winter months, September to March.
Okay.
Um, So the B complex, it's gonna vary, but it's gonna have all the B vitamins in it. 1, 2, 3, there's not a 4, 5, 6, there's not a 7, 8, 9 and 10, yeah. 9 and 11, 12.
All of the B vitamins, but then maybe just make sure you get the 2,500 in the B12.
So I actually have people take a B complex and oftentimes, and then have them take a B12 on top of that.
Okay.
So here's how I dose my B12. So when my brain is not sharp and it's not thinking like this, I know I need some more B12. And I use a lot of it because it really does, and that's something that I've just noticed over time. There's also genetic polymorphisms, just like we talked about the MTHFR gene, that make our B12 not quite as active. I have one of those, and now that's why I realize that's why I need B12 all the time.
So I do have that, and I'm taking something called B-methylated 2, but I've never
Yeah.
looked to see, is it B12, so should I also take
So-
B12 in addition?
Methylcobalamin is the active form of B12. And you said you have one called
B-methylated 2. It's like
B-methylated
methyl
2.
folate.
Is it the number 2 or is it TOO?
I'll talk to you afterwards.
Okay,
I
I was
just
gonna say,
wanna
because
know
it
if I
might
should
be a
add B12.
complex that has, so look on the back and see if you have methylcobalamin and then how much it is. But, and 5,000 is not, if people are low, I have them start at 5,000. And I have them get the sublingual ones, which bypasses all the problems that you're gonna have digesting it in your gut. And it's very quickly, it's shown to be raised levels as well as injections. Injections are great, but they're not methylated. So people that have a problem methylating, they're gonna get a lot of B12, but they're not gonna convert it very well. So they're not gonna activate it very well.
So then the drops are the best.
Drops are the best if you have problems with digestion, if it's the methylcobalamin, so, because it's already active. Good questions.
And then as far as the B9, did you say B12 if you're over 50? Or
Yeah, but I am not over 50 and I've been taking B12 for a while.
and also B9 in high doses, or you just
So-
do the B12?
B12, the B9 is more that I do more for symptoms, so anxiety, depression, mood problems, I hit B9. So B9 is L-methylfolate in its active form, and we actually have a prescription medication called Deplin, and it's 15 milligrams, so that'd be 15,000 mcgs, anyway, but 15 milligrams is the prescription strength. And the company that makes it, it is a medical food, but it does require a prescription. They guarantee or your money back. I mean, it's, so for people that have treatment-resistant depression, even it can be used as first line. It's probably because they have that methylation error, that family history where they don't do that very well. And so they just don't have, you know, the raw building blocks that they need to make those neurotransmitters. Okay, any other questions?
What about adolescents? Would this be helpful?
It would be. So actually, because you guys want recommendations, there is a company that Costco, I think maybe they might even have it at Walmart now, it's called Smarty Pants, that makes gummies. And they have a little bit higher dose of vitamin D than normal vitamins would. They have a few other non-essential vitamins and nutrients that are in there that I feel like are good for people. And they have the activated vitamins. So the B5 or B6 is activated, the B9, which is a folate, is activated, and the B12 is activated. So that is really good. This is, there's a lot to go into, but especially for kids, since we're on this topic, for kids that have behavioral problems, probably they have methylation issues. So the more refined and processed foods that they consume, the more folic acid that they're getting, and that overloads the body because it cannot process it. And so it can't process it to make it L-methylfolate because folic acid has to be transferred to folate, then it has to be converted to L-methylfolate before it can be activated. And that's the building blocks for those neurotransmitters, the dopamine, the norepinephrine. If they can't do that, they're not making their B12 active either. So they're getting all these things. They get up, they have cereal every morning. That's a high dose of all of those B vitamins that are not active, and it literally just bogs down the liver. And then when they have other insults, so it could be added stress, it could be a poor diet, it could be not pooping, it could be all those other things. When they have all those other things then on top of them, then their liver can't even, I mean, it's just bogged down. Our priority is always going to go to our liver before it's going to be to activating our B vitamins. And so when it's got all that toxic load, it just can't methylate our vitamins, and so we're going to have behavioral problems. Those kids probably have gut problems as well, and if we'll work on those gut problems, if we work on those, getting out those refined and processed foods that are so heavily laden with that folic acid, for those people that have that MTHFR gene, it makes a huge difference, huge difference. So that's onto the kids' ones, but that is a good vitamin for the kids, is that Smarty Pants, and they have ones for women as well. They're gummies, and you have to eat like a ton of them, but the kids, it's a good one for them. It's a good one for the kids. They do have ones for women as well.